The UN says some 95% of Afghans aren't getting enough food to eat. This in a country facing its worst drought in 40 years, in addition to an economy in freefall since the Taliban took over. The biggest impact of all this is on the most vulnerable, Afghanistan's children. Unicef says more than 1 million children under the age of 5 this year could become so malnourished they'd be on the verge of death. Our next report profiles these children, but a warning, some viewers might find some images distressing.
Their tiny bodies wasting away from hunger. These infants at the Minway's hospital in Kandahar province are dangerously underweight, their immune systems severely compromised. Medical staff here are seeing cases like this in alarming numbers. Mothers are helpless to ease their baby's distress. Both desperately need food.
I wasn't able to breastfeed him properly, and now he's in this situation. He's constantly losing weight and cries a lot. I know it's all because of hunger, but I can't do anything.
The hospital has admitted more than 1,000 children with malnutrition over the past 6 months. 30 of them didn't survive. Afghanistan's most vulnerable are falling victim to the country's multiple crises. The reasons for the increased number of cases are many. The first one is drought. And then there's the shortage of food supplies and joblessness. Many people are out of work. So when there are a lack of jobs, drought and poverty, the number of severe acute malnutrition cases will increase. After the Taliban takeover last year, emergency aid managed to stave off an outright famine over the winter. But now food relief efforts are struggling to keep pace. And agencies are warning of worse to come. Here in Kandahar city, entire families are struggling to feed themselves. This mother's 8-month-old son died from malnutrition just weeks ago. Now she fears for her other children.
The government hasn't helped us at all. No one has asked us if we're hungry or have something to eat or not. If someone doesn't help or support us, I fear my other children will also die of hunger.
But with war in Ukraine threatening global grain supplies, Afghanistan's cries for more food are becoming increasingly difficult to answer.
And joining me now for more from Kabul is UNICEF Afghanistan's Chief of Nutrition, Melanie Galvin. Ms. Galvin, do UNICEF and other aid agencies have the resources they need to be able to help Afghanistan's children?
I would say at this point in time, no. We're seeing a situation that's getting increasingly worse. And really, we haven't seen very much funding in the past couple months. So the situation's getting a little bit ahead of our ability to fund programs to deal with it.
Now, last December, UNICEF had issued its largest ever single country appeal for Afghanistan that was valued at about $2 billion. Are you saying that money didn't arrive?
No, and I was speaking on nutrition funding, which I know a bit better than probably the broader basket. We're substantially underfunded from where we need to be. We're looking at possibly 1 million children, over 1 million children this year that will be severely malnourished, and that's an astounding number for us. We have received actually really excellent funding from Germany, and very, very thankful for that, which will allow us to do some prevention programming, and again, fully grateful. But the situation around acute malnutrition has got ahead of some of our ability to prevent it as well.
Talk to me a bit about the malnutrition issue. I mean, what about the long-term impacts of this in Afghanistan? Are we looking at lasting health issues for an entire generation?
Oh my goodness, yes. You definitely, although we can treat, a severely malnourished child, and 9 out of 10 children are treated and recover. It actually does have repercussions, and one of the strangest is it has a kind of long-term effect on diseases, non-communicable diseases like diabetes in later life, obesity in later life, strange things that you wouldn't think of. We also, acute malnutrition will also affect the intellectual kind of ability of a child going forward, which of course has a domino effect because their ability to learn in school is affected, their ability to get a good job is affected. It's a disastrous situation, really.
So what do aid agencies need to be able to help Afghanistan's malnourished children?
Well, there's a couple things right now that we find are really quite critical. The situation, the reason we're seeing malnutrition is really kind of multifaceted. There is a drought, there's poverty. We've got really kind of outbreaks of serious health issues, all sorts of things that impact on the nutritional status of a child. And therefore, one of the things we actually need, and we've been searching for, is programs that allow us to deal with cash to give to families, because families will actually choose food and education and healthcare for their children, but it allows them to make those decisions themselves a little bit about how they want to split that up, because depending on the needs of the family, what we call food insecurity, a family's ability to feel comfortable that they have enough money to buy their next meal, right, it's really right now quite a bad problem for us. And so that's the sort of thing we're looking for, is cash to help with those programs.
Can you talk to us a bit about the role that the Taliban are playing in all of this? I mean, how concerned are they about the situation? And do you find that they are taking active measures to help the people they rule?
Yeah, the Taliban have been always very interested in this situation. They've allowed us access to areas for which we had no access for 20 years, which is just a remarkable change, starting even September, October. So they were very encouraging to get out to areas that had seen virtually no help in the past. I would say we have a good coordination relationship with them. We don't have a financial relationship, of course, but they have come out with their own funds to co-monitor programs. So we do find around health and nutrition, they're very interested in the well-being of the population.
We'll leave it there for the time being, but thank you so much for joining us today. UNICEF Afghanistan's Chief of Nutrition, Melanie Galvin. Thank you so much, ma'am.
Oh, thank you very much.